Good morning and welcome to the 29th meeting of 2025 in Session 6 of the Equalities, Human Rights and Civil Justice Committee. We have no apologies this morning, and we also welcome back Paul O'Kane as a member of the committee, and I would like to thank Rhoda Grant for her time and her input during her short tenure as a committee member. Our first agenda item is to agree to take agenda item 3, which is consideration of a draft report on the committee's pre-budget scrutiny for 2026 to 2027 in private. Our members agreed to take this in private. We are agreed. Thank you. Our second agenda item this morning is an evidence session with the Deputy First Minister and Cabinet Secretary for Economy and Gaelic following publication of the committee's report on the British Sign Language Scotland Act 2015, which was published on the 26th of September. I refer members to papers 1 and 2 and welcome to the meeting Kate Forbes, Deputy First Minister and Cabinet Secretary for Economy and Gaelic. The Deputy First Minister is accompanied by Kevin McGowan, Unit Head of the Scottish Government's Equality Division, Kit Wyeth, Interim Deputy Director for the Inclusion, Attainment and Wellbeing Division, and Lucinda Fass, Additional Support for Learning Policy Officer. You're all very welcome this morning. I now invite the Deputy First Minister to give an opening statement. Thank you.
Thanks very much, Convener, and good morning everyone. And I'm delighted to be back to discuss the impact of the BSL Act 2015, the BSL National Plan and BSL Local Plans following the committee's inquiry report. This is, as you know, a very significant year for BSL in Scotland as it marks 10 years since the British Sign Language Act was passed. And in those 10 years, the Scottish Government has produced 2 national plans alongside local BSL plans produced by listed authorities. I'd like to acknowledge the significant contributions of the deaf and deafblind communities, interpreters, practitioners and representative organisations whose work has delivered tangible improvements to the daily lives of BSL users. The committee's inquiry has provided a valuable opportunity to recognise which actions have succeeded and to identify where further progress is required. And that's why I very much welcome the committee's scrutiny, because none of us believe that the situation is perfect. I've met many community members over the course of the last year, and they've told me about the practical implication of the BSL Act in their lives and the good that has stemmed from it. But they've also pressed me quite robustly on the challenges that still exist, pointed to areas like health, education and the importance of embedding BSL language and culture at an early stage of young people's lives. And over the period that I've been in government, I must say that it's been one of the most inspiring engagements that I've done, listening to BSL users and understanding their experience and where they want to see further progress. We remain committed to improving the lives of BSL users in Scotland, and the current BSL National Plan concludes in 2029, and at the heart of the plan is a clear focus on accessibility of public services and tackling the systemic barriers that are faced by BSL users in their daily lives. The 10 priority themes in the plan are areas that the deaf and deafblind communities have told us are important to them, like education, health, justice and culture. But those are wide-ranging sectors covering all aspects of society, and the scale of the task is quite significant. Now, that can't be an excuse, because dismantling barriers is the right thing to do. It needs to be a priority, but it does require that whole-scale change. We've been clear that the 6-year plan is not static, so it needs to continue to evolve, learning from and building on the actions within it during its life cycle. To the committee's report, your committee report has provided us with the opportunity to reflect on the actions that we've set out. So you made 44 recommendations within your report. We've assessed each recommendation against 2 key factors. 1, the extent to which it aligns with the priority areas and actions in the BSL National Plan. And secondly, its overall deliverability, so resource and cost implications. We've accepted, either in part or in full, 40 of the committee recommendations, which I think is quite a significant majority. But we've also agreed to further consider 3 recommendations, noting that some more detailed analysis is required to determine the cost and the deliverability of the proposals put forward. But we're very happy to come back to the committee to give an update on the progress of those 3. We declined one recommendation, just quite simply for the reason that it's for the Scottish Court and Tribunal Service and not for the Scottish Government. So nothing more profound than that. So in accepting the recommendations, we are reaffirming our commitment to tackling barriers. And in doing so, we also recognise the importance that other key partners, such as listed authorities who are responsible for delivering BSL local plans, also need to play. And that's why we've created a support network for listed authorities to enable them to share good practice, resources and raise challenges. And that network will encourage partnership working, improving data collection, fostering connectivity and enabling greater accountability. Lastly, the BSL National Plan Implementation Advice Group also plays a very key role in informing actions delivered under the plan, and each partner has taken an active interest in the committee inquiry, with some of their points helping to inform the recommendations. So the second year of the current plan is focused on delivery. We want to work across all portfolios and look for opportunities to strengthen and embed actions for change. BSL users have made it clear to me and to this committee that the BSL Act is an important piece of legislation, but it's taking it from law and implementing it in reality and ensuring that everybody has the same experience of being able to access services fairly and with equity. Thanks very much.
Okay, thank you. We will now move on to questions, and I'm going to start us off by asking, what was the overall response from the Scottish Government to the recommendations, specifically in the report?
Yeah, so we, first of all, the very fact that the committee did the inquiry is something that we strongly welcome. And the fact that we have essentially accepted with the majority of the recommendations, and the only ones where we haven't accepted them outright are because some detailed work is required, and that relates to only 3, I think reflects the welcome of the committee's recommendations by the Scottish Government. I said in my opening speech, assessed every recommendation against 2 key factors, and I think that the key actions that we will take forward, I could go through that if you don't mind. It might be a bit more long-winded, but I could go through that in particular. So funding a BSL network for listed authorities to share best practice, providing support to improve local BSL plans, exploring and costing a national BSL tutor course for Scotland in engagement with education and BSL partnerships, engaging with key education professionals and BSL stakeholders to develop new and enhanced best practice guidance to support BSL users to become registered teachers, promoting both Contact Scotland BSL, including the introduction of video relay interpreting, and Signport with regards to digital exclusion and rural access, undertaking a review of additional support for learning, and that's why we're delighted to have Lucinda Fass join us today, and revising guidance on appropriate qualifications for teachers of the deaf, and considering existing opportunities for pupils to learn BSL within the current programme of curriculum qualifications and assessment reform. So those are the sort of top line, top level sort of actions that are directly stemming from the committee's inquiry.
Okay, thank you. We now have questions from Paul O'Kane, please.
Thank you very much, Convener, and good morning to the Deputy First Minister. And I suppose I have returned to committee whilst we're at this sort of concluding stage of this piece of work, but was able to take evidence previously. And I think, you know, in that evidence, we heard a lot of views about, I suppose, the parity of esteem that BSL will be held in along with Scotland's other languages. And of course, nobody would want to set languages against one another, because I think it's important that we have that richness and that support for them all. But one of the things we did hear is a lot of asks around an oversight body for BSL, and similar perhaps to Bord na Gaelic, which obviously has an important role in terms of support for the Gaelic language, but also I think being able to speak a bit of truth to power and being able to compel very often, if that's the right word, local authorities and others to act to deliver on Gaelic. So I wonder, you know, the Deputy First Minister and I think had this exchange in the first evidence session, but you know, has she sort of evolved in terms of her thinking around that, whether a national body for BSL might be something that would be worth looking at?
So I think we put in our response that we are very keen to explore this. So we understood from the committee the sort of the desire for a BSL national centre or a national oversight body. You very kindly didn't go into excessive detail about what its function or remit would be. So the commitment that we've made is to explore this further and to look at. We basically think this idea warrants further consideration. So it's definitely something that we want to explore further, and we want to understand how it would fit within the Scottish BSL landscape, and what its value would be to the BSL community in particular, and then also obviously the inevitable what sort of resources would be involved in that. But none of these are showstoppers. They're just a very simple commitment that we are keen to explore that further and to look at what role and remit it might have. And obviously, if there's a particular appetite from BSL users for that, then there's nothing within government that is opposing that suggestion.
I suppose that's welcome to hear, and I'm sure will be welcomed by those who gave evidence in the BSL community. I just wonder, in terms of timing to a lot of this, in terms of actions. I mean, we are in a challenging time frame in terms of coming up against the end of the parliamentary session and the election. I mean, is it something that the government would view starting work on pre-election and then ensuring that there's that legacy piece? I suppose, do you have a view on how that might take shape? You know, would it be a consultation? You know, I appreciate it's hard perhaps to say, but I think people will want just a wee bit more detail on what that commitment is.
Yeah. So we've obviously started the process because we had to respond to all of the committee's recommendations anyway. So we have gone through all of them and established which ones are fairly straightforward to just go ahead and implement, and then others that are going to take a bit more time. This one falls into the latter category of it's going to take a bit more time. I guess I'm speaking with personal experience, having just come through the Languages Bill. I wasn't in government when the Education Committee first started taking evidence on the Languages Bill, but I do know that the feedback on Bort na Gaelic, for example, was kind of 50-50, that maybe a commissioner would be better than a board. We decided to stick with Bort na Gaelic. So I am conscious that there'll be some strong views on whether it should be a sort of a board structure or whether another format would be best. So in terms of timescales, I think it's highly unlikely at this stage that anything new is going to be introduced prior to the election. So my view would be that you do all the work in advance of the election with a view to an incoming government being able to pick up the mantle and build something. So that would be my thoughts on it. In terms of, I don't know if any of the team want to say anything about consultation and so on. I think we need to flesh it out a bit further, and we probably need to take more informal consultation first before doing something formalised, because I think if you move straight to formal consultation before the idea has been, I don't know, is that the word, socialised? The idea has been sort of circulated and people have a view on it. I think that's premature.
I think that's fair, but from my inference from what you said is that there will be work ongoing even at that informal level. Yes. with those who've been the consultees in this space. So I think that is welcome, and it's certainly something I'm sure this committee will want to reflect in terms of legacy reporting from the committee's point of view. I wonder if I can just move on then to just talk about compliance with the Act currently. So we know that from the evidence we heard, 62% of listed authorities complied with statutory duties in terms of BSL translations and also their authority plans. What steps is the government intending to take to improve compliance? Because obviously 62% is not where we would want it to be.
Yeah. So I think there's two parts to this. One is the support element and then one is the reporting element. And I'll maybe come to one of the team just on the reporting element, because I'm obviously very keen on robust reporting mechanisms to ensure that everybody's doing what they need to do. Having said that, I also think it requires better input support so that listed authorities know how to meet their statutory obligations. And it's very easy to sort of condemn where it falls short, but actually working with organisations to be better. So that's where the network comes in. So the network will recruit expert deaf BSL user consultants who are sort of extremely experienced or have expertise in different areas with relation to the BSL National Plan. So that could be in areas like justice. I know previously this committee has asked me about questions of justice, education and health, so that there is a lived experience that comes in. They will then be recruited by the network, and the network will be supporting listed authorities to share good practice, provide them support, encouraging better partnership working, expanding and creating opportunities to improve data collection so the reporting is meaningful, and analyse the local BSL plans. And it will last for 2 years to allow for an evaluation of its effectiveness as a route. It will also broaden the reach to some key organisations who were formed since the Act passed. So, for example, Social Security Scotland and organisations that are not contained under the Act who have voluntarily done their own BSL plans. And Alliance is going to work with the listed authorities and the wider community to produce and publish reports in BSL and in English to evaluate the effectiveness of this network model. And I understand from engagement with Alliance that they're very interested in this approach. They are very keen to be involved in the network, and I think it could be transformational to support the effectiveness of listed authorities as they support BSL users in Scotland. Now, I did say that maybe Kevin would come on to the reporting element, but I would like to see this network being effective and just giving a little bit of reprieve until it's embedded before being too robust on the reporting side.
Yeah, I think as well, we've made the assumption that listed authorities understand that their obligations under the BSL Act and that they are actively engaging with the deaf community to help them form their local plans. And there's some who are doing excellent work in that space, and there are others who need the guidance and steer. And that's where we feel as if the kind of peer support that would come from the network would offer that opportunity. So the network is a good place for people to discuss how they're collecting data and how they're monitoring and analysing that data within their local context. Also an opportunity to share good practice around what's working well in different parts of the country, and also to help establish partnership working. So that does provide the kind of wider opportunity to improve overall reporting and engagement, really to assist listed authorities. And the way we have set up the structure with the Alliance enables that work to continue over a longer term piece. So continuous loops of learning will be embedded from the outset.
I think that's quite comprehensive and conscious of time, so hand back to you, convener. Thanks.
We have questions from Maggie Chapman, please.
Thanks very much, Karen. And good morning, DFM. Thank you for joining us this morning, and hello to your officials too. In your opening remarks, you talked about the national plan and how it's not static, how it needs to evolve and build as we go through. I wonder, and I note in the correspondence you sent the committee that the comments we heard during the inquiry and that we highlighted in the report were about how the second national plan appears watered down. And you partially accept that, but then you give that sort of space for building, for evolving. And I just wondered what you could, if there are any comments you want to make on the robustness of the plan, how we make sure that it actually does deliver and doesn't feel like it's not as ambitious as it should be.
Yeah. No, and I am aware of some of those comments. It's one of those areas where it's difficult to be as robust and perhaps other things, because I wasn't here in the formulation of the early part of the plan. But I do agree, do confirm it's not a static document. It's designed to be responsive to new barriers that emerge for BSL users over its 6-year life cycle. I do know that BSL users were consulted extensively as part of the development of the second plan, and there was a steering group including representatives from organisations of the deaf and deafblind communities contributing to the action. So, and those discussions were very wide-ranging. But we are committed to ongoing engagement, and we have established the Implementation Advisory Group specifically to tackle delivery. So I always think that irrespective of how ambitious or otherwise a plan is, you could have a super ambitious plan that isn't implemented and it's not much use, or you could have a plan that feels less ambitious, but if it's implemented, it could be totally transformational. So we are on an ongoing basis constantly engaging with BSL users to reflect their lived experiences. And there are several actions requiring collaborative working as well, so like in education, health and justice. And I think there has been some really exciting progress, particularly in education, through the Education Bill too. So there has been progress, but that's how I see it. That's how I see it working. And I think the Implementation Advisory Group is the key driver of identifying solutions to any challenges that emerge that weren't necessarily captured in the national plan. Does that answer your question sufficiently?
Yeah, I suppose one of the comments, actually, some of the comments we heard during our evidence gathering was around, you talked about the engagement with BSL users during the development of the plan. Yes, that happened, and yet they were still disappointed when the final plan was developed. They thought certain conversations had gone further than were reflected in the plan. And the National Advisory Group, I think, that you talk about is one mechanism, certainly, of ensuring that we can more than tweak, but we can really make the next few years as ambitious as possible, because we might tick all the boxes, but if those boxes don't actually deliver meaningful change, I accept your point about the education, and I think what you outlined this morning about some of those high-level priorities around engagement, around reviewing qualification guidance, all of it, that's really good to hear. One of the, I suppose, just delving into that, given, and this maybe follows on from Paul O'Kane's questions, given the need to support other public bodies, how do you see the sort of role of engagement with the government, other public bodies and BSL users? How do you see that sort of triangle working, and where there will be disagreement, where there will be frustration because of resource allocations and all that? How do you see the role of engagement in making sure that the plan delivers for BSL users?
Yeah, and others may want to come in, particularly on education, but I do see an important role. So I think that we should obviously be accountable to Parliament, and Parliament, like committees, should be very robust with government as to where we are not doing enough. But I think that with other listed authorities, we need to almost channel that robustness to other listed authorities. Now, they are not necessarily answerable directly to government. So, like, local authorities are not directly answerable to government. But I would, I said in response to Paul O'Kane that I want to see the network work well before we get too robust in reporting. But once the network is established, once there is very obvious, extensive access to support, there's absolutely no excuse for not comprehensively delivering the service that they are statutorily obliged to deliver. And one of the areas which I frequently come across is that some people have brilliant experience and some people have really poor experience. In other words, that postcode lottery element is down to local delivery and not necessarily down to the entirety of a particular part of the public sector. So, for example, you might have somebody's experience in accessing healthcare as really superb. And in another part of the country, it's really poor. Yeah. So the problem, therefore, isn't health boards per se, is every health board recognising its obligation in this regard. I did some engagement over the last, I think it was maybe 6 months ago, with Highland BSL users. So we specifically decided to go outside. It wasn't just that it was close to home, but we decided to go to a rural area. And I was blown away by how different the experiences were in a rural area compared with some of the engagement I have. And most of my engagement, to be honest, has been in Edinburgh. You know, it's with organisations that are located in Edinburgh. So it was totally different because even some of the basic elements of being able to get an interpreter, there's just fewer interpreters, harder to access education or training rather. So I think my thoughts on this are, you ask about listed authorities and support. There's the support, but there's also the recognition of an obligation. And we expect equity across Scotland, irrespective of where somebody is. And that, I think, needs to come through more, perhaps, in our monitoring of, it might be that COSLA says they have now implemented X, Y and Z. Fine, great, but does that filter down to every local authority? And even within local authorities, is that filtering down to everybody's experience of engagement? So I think that's where, I don't know if the officials, you can see this is where we start making up, not making up, sorry, but making policy in direct response, almost like live policy, because I'd like to know if we have a means yet of monitoring that intensely local effect beyond just people raising their lived experience.
So I'm in agreement, Deputy First Minister, you'd be glad to know. But yeah, the kind of the local level, it really is BSL local plans are imperative there. So, for us at government level, being able to engage with listed authorities to understand what is happening locally is crucial. So the network will definitely provide an avenue for that. But also, to our credit of a lot of our stakeholders, those who sit on the Implementation Advisory Group, they are very close to different parts of the system, whether that's at a community level or listed authority level. So again, they are gathering data and intelligence and feeding that back through the Implementation Advisory Group and therefore the BSL National Plan. So the mechanism is there, whether it could be strengthened, absolutely, and whether we need to be careful not to overload deaf and deaf-blind BSL users with constant consultation fatigue and actually concentrate on the actions that we're doing and demonstrate the actions and what they are doing for their lives. So, but I take on board the point you've made.
No, thank you for that. And I suppose I think there's a concern that the plan could have been more ambitious, but if the local plans have that ambition, then actually that's maybe more effective. And I don't think there's disagreement about sort of government setting. These are the standards we would expect, but with that understanding that in local areas, different public bodies, different listed authorities will need to work through those differently because of geography, because of rurality, because of all sorts of different things. So I accept that, and I suppose it'd be interesting to see progress on that, in subsequent years. I'll leave it there because I know others want to come in specific details.
Okay, thank you. And just on that point, we did take a lot of evidence from people with the lived experience backgrounds and BSL users and deaf-blind as well. And I think one of the key points in regard to consultation fatigue is that if somebody isn't seeing actions or any tangible outcomes from what they've been consulted on and time and again coming up with the same issues, I think that's where consultation fatigue kicks in, because if somebody is consulted, they're happy enough to keep going when they see that their their input has actually attributed to some kind of change. So I think when we see that consultation fatigue, it's important to note, OK, there maybe just hasn't been enough changes for these people yet, to empower them as well to want to feed back. OK, we now have questions from Tess White, please.
Thank you, Convener. Good morning, Deputy First Minister and officials. My question is around education. And thank you in your address for saying that as part of the planning, you're costing a national tutor course and you're going to support BSL users to become teachers. So do you have any other thoughts to increase the number of deaf BSL users qualified to teach BSL using pupils?
Yes. So we, and this is where I may come to Lucinda in a moment, or somebody else shortly. But there's a number of routes, I think, to supporting more trained teachers and tutors, if I could expand it to tutors as well. Because we have right now qualifications, accreditation and training for the BSL tutor workforce delivered by various different bodies. There is a shortage of this workforce across the country, and that obviously has a negative impact. So there is, what we're looking at right now is whether we could essentially establish a national provision to bring more individuals into the profession and to upskill those who have some proficiency. So taking all the different organisations that exist right now, so there's the BDA and BSL learning partners like Signature, there's Qualifications Scotland, there's higher education institutions, and it's all very sort of piecemeal. So the first active step is to essentially bring them together and say, OK, where are the gaps right now? And can we do something jointly? Can we do something national to bring more individuals into the sector? I think that's really critical because certainly from some of the conversations or the engagement that I've had, BSL tutors are absolutely critical. So there's the point here around training teachers in our schools, but actually BSL tutors that supplement what is happening in our schools has struck me in all my conversations as being some of the most transformational experience. So I just make that small distinction. In terms of supporting BSL users to become teachers themselves, we are looking at whether the initial teacher education ITE university could create a specific dedicated course for BSL users. That does take some years of development and approval within a university, followed by GTCS accreditation. So it's not a sort of quick approach, but it is something that is being considered just now. It does need to be taken forward through engagement with each of those organisations. It's not just something that we could say unequivocally that we will do right now, but it's something that I would be very keen on looking at. So those are two direct actions about supplementing the current provision. But I don't know if any of our teaching officials, or education officials rather, want to add to any of that. Or not really? Okay. Yeah.
Thank you. A follow-up question is around you can't manage what you don't measure. So was there a starting position? Do you have a starting position for trained teachers who are deaf BSL users? So 10 years ago, after 5 years, and then now, and projections?
I think we need to come back to you on that because I can't find it quickly. I'm pretty sure we would have some data on that, but probably not at my fingertips.
Thank you. So if you could come back with that, that would be appreciated. And my second question is around, and we heard about the isolation that some deaf pupils felt being in mainstream schools. And so my question is about how might support for deaf pupils in mainstream schools be improved moving forwards? Thank you.
Yeah, so two parts to this. One is from the teaching perspective, because the committee had suggested that teaching students should spend some of their teaching placements in deaf schools or hubs, and I think that's a brilliant suggestion, just in terms of exposure and experience and so on. Again, when it comes to education, I have to say that some of these decisions are for teaching bodies, but it's certainly something that I thought had a lot of merit. But then in terms of essentially inclusion within the curriculum, it's a central value of education. It's absolutely critical. On this one, I think I am going to come to official for inclusion.
Absolutely. So mainstreaming is a central pillar of our inclusive approach to education in Scotland, as I'm sure you'll know. But we acknowledge that mainstreaming education for some children and young people who are deaf may be isolating, for example, if there aren't other pupils in their school who are deaf. The presumption to mainstreaming has a number of exceptions that can be applied. So it would be for the local authority to make assessments on where the child could be educated, if that could be in a deaf base or a deaf school. And also taking the wishes of the child and the family into account at the same time. But there are also geographical considerations there, because obviously in some council areas there might not be an obvious local place for a child to be educated, and that's where the teacher of deaf children and young people come in, and the BSL tutors are so key to supporting that child within the mainstreaming environment.
Thank you. And Deputy First Minister, just a thought, in terms of bandwidth of your team, has BSL and training and education of BSL users and tutors been factored into the objectives of your officials? And roughly what percentage of time are your officials spending on this?
Yeah. So we've got two groups of officials here, if that's... or maybe we've got three, but generally I think we've got two. We've got those that are dedicated to BSL in the Equalities division that directly work with me. And then we've got education that directly work with Miss Gilruth. So wouldn't directly work with me, but are doing a lot in... So in terms of, on the BSL side, it's 100%.
Wow.
So it's, there's dedicated officials to support me in the work around BSL. On an education side, I'm afraid I can't answer that.
I probably can't quantify it exactly. However, sensory impairment education falls into my role, and I work closely with Equalities and colleagues over on that side. So it's the additional support for learning policy brief is large. There's lots of things in it, but the sensory impairment education forms a part of that.
I'm in my head, I'm thinking around 10%. Would you say that's a high figure, or...?
I wouldn't want to quantify it because we have so many policies.
But it's in there somewhere.
It's absolutely in there, and because of the recent work on the consultation, it has been, active. It's been active. Yes, I've been working actively on it.
Thank you. Sorry.
I would just say, sorry if I may, that there's a team that deals with additional support for learning in its broadest sense, and so I suppose the work there fluctuates in terms of the priorities that come nearer the top and lower down from time to time. But as Lucinda has said, we have staff dedicated specifically to working on sensory impairment within the education staff. Again,
that goes back to my point about you can't manage what you don't measure, and having it part of your mainstream is important. So my final question, Deputy First Minister, is have you and your officials any thoughts on piloting BSL learning opportunities for all pupils in Scotland?
Yes, so it's obviously in terms of the languages, in terms of the sort of mainstream curriculum. Right now, BSL can be taught in schools as a second additional language within the 1 to 2 approach. The 2023 1+2 languages survey of local authorities showed that 11% of primary schools were teaching BSL as an L3. And in terms of data in high schools, I don't have that right here, but I think the exposure in primary schools is probably the most important area. And at the moment, Education Scotland are leading on the delivery of the curriculum improvement cycle, which will ensure that the curriculum obviously is forward looking, and all 8 curricular areas will be considered, including languages, and Education Scotland have confirmed that BSL is included in the draft curriculum improvement cycle documents that the languages team has produced. So, and BSL is offered as SQA awards as well. So it's referenced in the languages evidence paper, and that will be published in January. So I think my view is that on paper, there's access and there's provision. I hear constantly it's about the teachers and it's about the tutors, and it's about making sure that teachers feel confident in teaching BSL in primary schools and in secondary schools. And the other challenge that I've heard is that the balance between ensuring that there is a pipeline of teachers who are proficient in BSL to support BSL using children, and at the same time wanting to use the same resource for non-BSL users who should be exposed to BSL. Does that make sense? So I think that is the tension that we have, which can be overcome with more BSL tutors and teachers, full stop. Because then you can spread them more thinly across those BSL users who need that as their primary source of teaching, and those who don't need it as a primary source, but whose lives would be enriched and who could enrich other people's lives if they had access to BSL. So that's one of the tensions in all of this.
Thank you. Back to you, Convener.
Thank you. Pleased to hear that there will be that consideration. I think you said in the opening statement as well that there may be BSL embedded in the language, the curriculum. Is it the 2+1 languages programme? That's excellent to hear, because I think if we think about the isolation of deaf children in mainstream schools, a lot of it is because their peers can't communicate with them. And when we think about ASN provision, the additional support need is more often than not, although deaf children can have more than one additional support need, is more often than not just a language difference. That is it. And I think focusing on that, I know it's multifaceted, will make a huge difference. I want to put across some of the lived experience that we heard, Deputy First Minister. We had a young student who was telling us that they were going to sit a higher exam, but the person they had in to support them was an interpreter who was only at level 1 or 2 BSL. So if you could imagine sitting higher maths and the person in that is supporting you is maybe a primary school level mathematics, and that wasn't the fault of the child or their ability. That is completely down to the lack of that language provision. So when we talk about the attainment gap and what we can do to close that, I think looking at these types of issues is important. And I think that's why we look at the Gaelic language model as well as something that is so fantastic, and rightly so incredibly proud of that. But I think it is something that we should be aspiring to as well, because as we know, language, it's not just about education, it's also about that culture that's wrapped around language as well, which is so vitally important to a person's well-being.
Yeah.
Okay, we now have questions from Marie, please.
Good morning, Deputy First Minister. During our evidence session, we heard about the challenges deaf people experience whilst trying to access mental health services, and I'm aware of the BSL resource through the NHS 24 Mental Health Hub. You might want to kind of maybe expand about that in your response, but I want to kind of ask what more has been done to improve access to mental health services for deaf people, and are you aware of any kind of good examples of joint work being done with our kind of third sector partners?
Yeah. So I think the bottom line is that we expect health boards and public sector employees to ensure that they are meeting all their public sector equality duties, and to ensure that the care that they provide is safe, effective, inclusive and high quality, in line with their statutory service provision. And therefore, there is an expectation that BSL users should be able to access mental health care and support in the same way that non-BSL users can. And that should be, that's a non-negotiable now. The question then follows, but why are people's experiences not equitable? And there's a number of responses to that, I think. First is there's the Mental Health and Wellbeing Action Plan. So that is aligning all the equalities activity across health and social care workforce. And they've got their own sort of delivery plan and action plan, and it highlights work to embed inclusive practices across the health and social care workforce and so on. So that brings together senior leaders from key sectors and organisations to develop a shared understanding of the critical areas where education and training will support that wider ambition of the mental health strategy. But it also is looking at how to raise awareness, uptake and accessibility of existing and reliable mental health training resources. So that's what's being done right now in terms of the Mental Health Wellbeing Workforce Action Plan. Having said all that, I think a lot of the issues come back to the same core problem, which actually is the root of any question that the committee might ask me. And that is about access to interpreters, ensuring that there's a proficiency, so to the convener's point around being able to access an interpreter, but them not being proficient in that, only level 1, I think you said. So being able to access interpreters, proficient interpreters. There's, we recently launched the Signport app, and the Signport app is basically about being able to book an interpreter and having the confidence that an interpreter will be there, so that you don't turn up to the GP or you don't turn up to another service and are unable to communicate. So I think I can talk a lot about the sort of mental health specific inclusivity work, but actually sometimes that could overcomplicate what is the core issue, and that is, can you access an interpreter when you need one, irrespective of the service that you're trying to access? And we've done a lot with the Signport app, and obviously Contact Scotland BSL has just relaunched on the 1st of December. But ultimately, if you train more interpreters, there'll be more interpreters there. If you do more training, then they'll be more proficient. And I think a lot of that is resolved through that investment in training.
Absolutely. I'll move on then to what consideration has been given to the emergency services in terms of have they been elected to deaf callers to ensure that there's the support there in place for them too? Yeah, follows on quite nicely.
Yeah. So the Scottish Ambulance Service are currently working with the British Deaf Association to look at what facilities they currently have in place for BSL patients and service users and how they can improve and develop in that area. And the ambulance service are looking at ways that they can make improvements basically in the way that they engage and communicate about their service. They are promoting how to be deaf aware to staff using RNID Scotland guidance, and there has been an increase in BSL users accessing the service via Contact Scotland and 999 BSL. So patients who are deaf, hard of hearing or have speech difficulties can use the SMS text service to contact the ambulance service in an emergency, and the SMS text service is available to all, but users need to register for that service in advance. And then with partners at Police Scotland and Scottish Fire and Rescue Service, SAS Ambulance Service have linked with TAP SOS, which is an organisation that has developed an app for use in emergencies, which is helpful for members of the public who are deaf, hard of hearing or have difficulty with speech. So that's the current provision of support that is available.
It's really a vulnerable time for anyone accessing emergency services, and obviously communication is key, so it's good to hear that. Thank you.
Yeah. Thank you. We now have questions from Pam Gossel, please.
Thank you, Convener, and good morning, Deputy First Minister, and good morning to your team as well. Deputy First Ministers, we heard some concerning evidence about the support available to death survivors of domestic abuse. A couple of weeks ago, I attended an event hosted by Eastern Bartonshire Women's Aid titled Empowering Deaf Women to Report Domestic Abuse. We were told that words such as consent and coercion were foreign for many deaf women, with many thinking that domestic abuse is normal behaviour. Unfortunately, we cannot understand the full extent of the problem as data collection is poor. That is why I have put a provision in my Prevention of Domestic Abuse Scotland Bill, which places a duty on the police and on charities to collect demographic data on survivors of domestic abuse, such as disability status, which has received strong backing from organisations and survivors. So do you agree that better data collection is key to understanding the full extent of the problem, and that better monitoring of offenders will prevent potential victims from becoming victims in the first place?
I do agree with that. I also attended an event last week hosted by the convener on specifically this issue. So it was the Sign Loud initiative, which is being funded for a year by the British Academy, and it's a joint project between Heriot Watt and the University of Edinburgh, looking at basically the connection, the links between domestic abuse and deaf community, and you know, how language barriers compound the challenges that are faced by women and children experiencing domestic abuse. And they presented a report to me with quite comprehensive recommendations, and I gave them total reassurance that we would take those recommendations away and report back before the election on what we could do on that, because some of the research they presented was extremely startling. Deaf women 2 to 3 times more likely to experience domestic abuse. The fact that it's a disproportionate effect on the children too, when they have to basically be exposed, sometimes because of a requirement for them to interpret on behalf of their mother. So just huge barriers. The event last week, we went with members from the Equally Safe team in the Scottish Government, as well as the BSL team. So another example of where there are teams in the Scottish Government that are not operating in silos. So they're trying to work together more closely. But I don't disagree with anything that you have just said. And I probably won't go into the detail about all the things that we're currently doing, because there is some good work right now. So the Delivering Equally Safe Fund is providing deaf links with funding this year, and that is a project that is sort of jointly integrated with Women's Aid and is supporting the delivery of the advocacy service for deaf women in the sort of violence against women advocacy service. So there is work like that going on, but I think it's hard to disagree with what Pam Gossel has just said, or what Sign Loud presented last week, in terms of the additional steps that are required to be taken.
No, thank you, Deputy First Minister. Since you've mentioned Women's Aid, I'm just going to go into my supplementary, then go back to my other question. Deaf women are entitled to access services in the way that suits them best, but unfortunately there is a lack of funding across Scotland for women's aid services to have independent domestic abuse advocates who are skilled in BSL. Staff do not always have these skills, so need to rely on having to access to an interpreter, which may delay access to appropriate support. So what action is the Scottish Government taking to ensure women's aid organisations are provided with funding they need to hire more independent domestic abuse advocates who are skilled in BSL?
So I think the answer is in that project I just mentioned. So Dundee, Angus and Perthshire Women's Aid are working with Deaf Links, and they're the organisation that we have provided funding to through the Delivering Equally Safe Fund. And that is all about providing an advocacy service for for deaf women. So it provides local basic needs assistance through advocacy support in BSL and specialist support for deaf women that are experiencing GBV. So I think it's an example. Now, the challenge you would put to me, rightly so, is that's great to hear for Dundee, Angus and Perthshire Women's Aid. What about all the other women's aids? So let me take that away and understand how successful this has been and see whether it's a model that could be rolled out.
Thank you, Deputy First Minister. That was actually one of the organisations that mentioned the project they were doing at the Eastern Bartonshire Women's Aid, and it was actually, they went through it. So, but the thing is, I was going to come back to you to say to you, what about all the others? And also the fact is, I have mentioned many times that funding is only for a certain amount of time, but obviously these organisations have to bring specialists in. It's important that we look at multi-year funding, that they can keep these specialists on year after year. So that's something I hope the Deputy First Minister will look at as well. My last question, Deputy First Minister, we were told that finding an interpreter is always at the forefront of deaf women's minds. And this can be even more challenging when they are at their most vulnerable stage after experiencing domestic abuse. Many interpreters do not feel confident taking on domestic abuse cases, and many times deaf survivors feel more comfortable speaking with someone whose first language is BSL. So what guidance will be issued to Police Scotland to ensure interpreters are provided with deaf complainers when deaf complainers make statements?
Thank you for that. Can I just flag again Signport? So Signport was developed through CivTech. So CivTech is, I don't know if you've come across CivTech, but it's basically an alternative approach to procurement, and it starts with lived experience rather than starts with a contract. And it is an app that allows BSL users to very quickly find and book an interpreter and to have that reassurance. So I was at an event a few weeks ago where it was getting tested with a room full of BSL users, and I think it could be quite transformational on that point around finding an interpreter. In terms of police, I did reference police briefly in my response to Marique McNair on emergency services, but can I, in terms of specific training, that's not something I have at my fingertips here, so unless anybody else wants to come in, we could come back to you. But Kim.
It's just to highlight, so they are operational matters for Police Scotland, but Police Scotland have an Equalities team in place who are connected to our stakeholders in the BSL landscape. So those are issues that are actively being pursued by Police Scotland, but we can kind of take that away and expand further, if that would be helpful.
Police Scotland to come back to you, maybe.
Yeah, no, that would be really helpful. Why I'm saying this is when I started off the work within the 3 years of my bill, working on it, I came across a survivor that basically had a kind of disability on a speech, and they had, their carers were with them, and they had told me that they contacted the police. She was being domestically abused, but when the police came to the house, the police obviously, she wasn't speaking, should I say, as the man was speaking, the perpetrator at the time. So they took the perpetrator's word to say that she was drunk, and that basically because no data was getting recorded on disability or anything, the police didn't know obviously how to act on that, because all the crimes we know, around 64,000 have been reported to Police Scotland. They've got no data of any ethnic background or any disability, so it's very hard for services to be provided if there's no data. And bless them, I think it's a great job that organisations are doing out there, from Women's Aid and all the other great organisations, because they're probably collecting more data right now than the actual Scottish Government, and then they have to provide the Scottish Government with evidence to say that this is a service we need, and it should be the other way down as well, both ways. But that's why I had brought this up, because I first hand heard from somebody that came across the fact that their disability You know, they couldn't get across that they were being domestically abused. And it's no, you know, no fault of the police here, I'm saying, because at that time the police didn't know and it wasn't something they collected. They still don't collect it. So I think that's something very important to highlight for you to take away and to understand where it's coming from.
Yeah, thank you. Thank you, Will.
Thank you. Any other questions from Paul? Then, please.
Thank you. Good morning, Deputy First Minister. A couple of questions. Time. One was around about issues about data and disaggregating data, and I'll come back to you on that one. Just your thoughts on that one. One of the other key issues, as in this area, was talking around about in education, health and justice. It was suggested about better support for BSL users would actually include people who are encouraging BSL users to actually take up roles in these. So it was to get your thoughts on how can we encourage that happening in the future. Can you go ahead? So a little bit about the data, but more around about, probably around about how do we get BSL users actually encouraging them into the roles where they can make a real impact.
Yeah, fantastic. So just on data then, so data is part of the national plan, and it makes very clear that actually if you've got good, strong data, then you can make better decisions on, particularly in public policy. And we have some really useful data that comes from the census too, that provides quite detailed insights into the characteristics and outcomes of BSL users. So, as you'll know, 2.16% of the Scottish population are BSL users. But it also reports on whether BSL is the main language used at home or not for BSL users. So you can do quite a good intersectional analysis of equality characteristics and outcomes for BSL users across quite a range of areas like health and housing. And that allows us to begin to understand where there's still an evidence gap and how to address that with existing or new quantitative or qualitative evidence. So the equality evidence strategy is looking at making improvements to the availability and analysis of equality data, and that's been carried forward at the moment. But it's just quite interesting. Yeah. There's quite a lot of data in terms of BSL users into roles. I think one of the most obvious, I guess, is in terms of teaching. In terms of becoming teachers themselves, because of the shortage of teachers, but across the board, basically ensuring that support in education allows BSL users to achieve their potential. One of my earliest engagements with the BSL community was deaf-blind. Or Deaf Action, Deaf Action on, I can't remember the street, but just in Edinburgh. And was really struck by the fact that across Scotland's history, because there was very early, a couple of centuries ago, very early provision of education for BSL users, Scotland really led the way and pioneered a lot of initiatives and transformed the deaf community and deaf-blind community. And it all comes back, this is what I was being told in my little history lesson, all comes back to the fact that there was early provision of education. In other words, if you have that provision of education early on and you equip BSL users with the tools that they need to go and achieve whatever they want to achieve, true enough, they went on to achieve everything they wanted to achieve and essentially led the way globally with new opportunities, new transformation, and so on. And this idea that education comes first, and if everybody has an experience through education where their needs are met, they are able to communicate effectively, then the world truly is your oyster in doing whatever you want to do. So, having said that teachers are an area that we need to focus on, the teachers are the sort of root, as it were, for everything, for a great experience in school, for sufficient provision at school, and then ultimately for everything that goes on in our economy and in all the other public or private sector roles that there might be, because with good education, all of those opportunities are opened up.
Thanks. Just a slight follow-up, if that's okay. Can we just on that? I suppose just on that specific point, DFM was talking about encouraging BSL users to take up the roles. Do we monitor that at the moment, or is that something we can monitor, or something we can kind of target? Because it's almost thinking, right, we can encourage it, but how do we monitor that? How do we evaluate that if we're coming back here in 5, 10 years' time to go? Is that something that's been raised? Are we then making sure we're accomplishing that going forward?
Do you mean basically BSL users going on to positive destinations when they leave school?
Yeah, I mean, I suppose, obviously the question is about to take up roles in the sector, so I suppose, as you said, education seems to be one, but there is obviously, if you're talking about 2% of the population, I know I've spoken to constituents before about some of the issues they have around about healthcare, for example, and so on, so it's just making sure that there is that representation across all the sectors. So I suppose if it is looking back and evaluating that, is it something that we're doing, or is it something we could consider doing going forward?
I think, we probably have variations of data on that. So we probably, there will be comprehensive data for school leavers, for example, on what a school leaver goes on to do. And then we obviously have the census data, and the census data gives data, I think, on employment too. So you would then have that intersectional data set on BSL users and employment. So we probably do have, I don't think we go out every year and collect data on, what jobs BSL users are in. But we probably have, I would suggest, the kind of data already that we could use to build a very strong picture. Unless anyone has anything to add.
I mean, certainly in terms of the positive destination data around school leavers, that is broken down by certain characteristics, but whether that would include BSL, I don't know. We can certainly come back on that.
Yeah, that would be really not a major point, but I just think it's important that we pick up that in terms of that. But no, I'm happy to, if you could come back to us on that, that would be great.
Sure.
Thanks very much.
Okay, thank you. That brings us to a close of this session. I just want to thank the Deputy First Minister and our officials for joining us today, and thank you for giving us a bit of hope there. I've noticed that the door is cracked open and there is considerations on a similar language model to Gaelic, and I'm sure myself and others will be pushing at that door. It's something that wouldn't just give hope to a lot of deaf people and support the deaf community if we look at the economic case for that, particularly with educational attainment and employment. The Scotland as a whole would certainly benefit from that. So pleased to hear that. And I just want to end on the note of the lived experience of one wee deaf boy in Scotland who was telling his teacher that when he didn't want to learn sign language because when he grew up he was going to be hearing, because he didn't have any deaf role models around him because of the isolation within the mainstream in school. And I think that for me has been something that's stuck out particularly as an experience that I think we should be certainly looking to build upon these recommendations for people like that wee boy. But thank you for your time. We will now close and go into private session. Thank you.